Well, for today's video, I want to talk about naturopathic hot takes because I've noticed that I'm getting a lot of feedback on, especially on YouTube in particular, uh, on Instagram and sometimes on TikTok. Actually, TikTok, you get a little bit more of some feedback. Like that's not necessarily agreeable feedback. Instagram tends to be a little bit more like, well, I follow you. I kind of like what you're saying. So you get a little bit more like people just be like, oh, I like that. Nice video. On YouTube, however, especially when it comes to like those shorts, I do like just clips. I get a lot of interesting feedback. Like I got a lot of negative feedback on the short video I did. I uploaded about dairy and how a lot of people react poorly to dairy. I don't know if that's news to anybody, and it's not an over exaggeration, or it's not like a painting everyone with the same brush. But at the same time, every single person I've ever tested for food sensitivities, dairy's 1A or 1B. That's just my experience. It's also my experience that when people cut out dairy, a lot of any type of their symptoms, not even a specific gut related symptom, those ones get better. And I can't tell you how many times people already come in having tried going dairy free and feeling better and giving me that feedback before I even talk to them. So it's interesting on YouTube. I don't know why people are very like defensive about their cheese and stuff. I guess they like really want everyone to like it and have to have it too. If you like cheese, knock yourself out. But I mean, it's good to have feedback, even if it's negative, I think. I also got, not necessarily negative feedback, but I got a comment yesterday. I put a video regarding skipping meals, how it could hurt your metabolism, which is true. And this person was like, well, I have a big breakfast and I skip lunch. I have a shake and I have dinner and I'm doing just fine. I'm like, that's great. Good for you. Watch the full video for context. People get, I picture them, they're like, they're going to send this guy a message, teach him something. So I almost kind of like the negative comments. I shouldn't though. I should like people could ask questions. People would be like, well, that's a little bit different than what I'm used to hearing. Tell me more about it. I had one person was like, I think I was talking about vitamin C, the benefits of vitamin C. And they're like, we all know that vitamin C is just a waste of money. And he's like, why don't you do some research? And I'm like, this sounds like your opinion. It doesn't really sound like fact, because there's tons of research about the benefits of vitamin C. But if you have something to the contrary, share it. To which their response was, I'm not the one with the health channel. You do the research, which I'm like, no, this is going to be cyclical, because like I did. There's tons of research. I've studied this. I've been in practice how many years? Over 15 years. I know a little bit about vitamins, and I still have to prove my case to some people that are they're not into that, which is cool. It makes me wonder how they saw my video in the first place, because usually it's geared towards people that are interested in vitamins. Regardless, so I wanted to do a video about other hot takes, since I'm on a roll, upsetting people. Let's see. I talked about dairy. Did I mention gluten? Yeah, that's crummy too. Why gluten? Well, I had this discussion with another naturopath who found that it was maybe more wheat as opposed to gluten, because gluten gets part of its bad rep for celiac disease, which that makes sense because they actually have the anti-gliadin antibodies, and that's how they partly diagnose it. But then I've seen people have things that are low in gluten, that are still wheat-based, like I think like spelt and that sort of thing, and it still bothers them. So it's hard to say. When I do, again, I would lean on food sensitivity a lot, and when someone's got an issue with gluten, it tends to correlate with issues with gluten containing grains like wheat and different types of wheat. So they have antibodies against the wheat protein, not exclusively to the gluten. I just tell everybody now, think about going gluten dairy free for a month and see how you feel. If you don't want to do the food sensitivity test, which is pretty definitive, try it. Just try it. And don't be a smarty pants and say, well, I'm going to do gluten for 2 weeks, but still have dairy, and then stop the dairy and have the gluten or whatever, vice versa. Don't do that, because you're probably reacting to both. Now, where do food sensitivities come from? Stress. I should do this as a TikTok. Stress, low stomach acid and enzyme production, poor protein breakdown, gut inflammation, immune activation. That's how I would break it down. Other hot takes, supplements and over-supplementation. Now, I'm not a big fan of someone being on a lot of vitamins, because vitamins are supposed to meet a deficiency. I've had people come in with grocery bags full of stuff that's either expired or never opened. It's a big waste. Does supplements replace food? No. Does your food cover your necessities? Not in my opinion, because of how the food's produced, and also because of how people eat. They have poor dietary hygiene. People don't know what protein is. People don't know how much to have. People think that bread has protein and pasta has protein. And sometimes they have a little bit, but hot takes. I want to keep it to the hot takes because I want to see how many negative comments I can get. Food sensitivity tests in general. People will be like, how? That's not scientifically valid. Well, it's scientifically valid for allergists, medical doctors that are specialists in allergy testing, to test for these antibodies, which they do readily. They just only do 1 or 2. We do 200. So if they think it's valid, I agree with them. They just don't lean on it very much because they do the scratch test, which I don't think is valid, because you don't necessarily consume food through your skin unless you're Mork. That's an old reference. It was Robin Williams. Other hot takes. Acupuncture. Acupuncture is like, but what does it even do? Well, in your body, we have electrical current, whether you believe it or not, but it's measurable. On the surface of the skin, there's a machine called a galvanometer, and it measures electrical potential, specifically looking for drops in electrical potential, and that is exactly where the acupuncture point is. And there's hundreds of them, and they're consistently located along anatomical landmarks that we learn. And we learned what these points are doing in relation to their function with an organ or multiple organs. So sometimes the point is a local point, which is like, there's a point here for the stomach. There's also a point for the stomach on the shin, which is like, how does that connect to this? I'm like, that's a good question. I'm not really sure. I'm envisioning or imagining it's probably something embryonic, because we know that the kidneys control, in TCM, Chinese medicine, controls the brain. But we also know that at an embryo stage, that the kidneys and the brains are kind of like this, and then they kind of pull apart and form the spinal cord, and there's a connection there. So a lot of things embryonically, just a tongue twister, there's some things anatomically related, relation to the organs and the skin and the nervous innervations. A lot of cool stuff. I like it. Not a lot of people like it. People who like it, love it. I'm talking about acupuncture. Some people are like, how can acupuncture help me with my symptoms? It's like, it can, because if your symptoms related to an organ and that organ is under functioning, I'm suggesting that these points we're stimulating upregulates the function of the organ. That's very contrary to Western medicine, because we are trained to treat symptoms as opposed to addressing the root cause of the organ or the organ interactions with one another. It's just a different language, a different way of addressing and understanding the body. So it's foreign to a lot of people, I understand, but just because it's different doesn't mean you don't dismiss it. Maybe look into it. Maybe you'll like it. Okay. I want to do a lot of the good hot takes, the ones that, oh, this is a nice one. I've been called a jerk a bunch of times for this one. When I suggest that there is an emotional component to a symptom. Now, that's very different, and it's not in reference to something, you're making something up in your head. It's not real. Like, oh, your stomach hurts? Yeah, it's just in your head. Just go take a nap and you're fine. Or keep you busy and ignore it. It's just in your head. There's nothing anatomically going on. What I'm really referring to is conditions can be a response to chronic emotional states. Like if you're frustrated a lot, you tend to have stomach issues where you actually have like a risk for H. pylori. See that now that's controversial in a sense, because now I'm suggesting that there's an endogenous, an internal cause for a specific condition, and that cause is related to your mood and personality traits. I just keep saying it. And there's a whole study on this topic. Not a lot of people like it because, in my opinion, people don't want to feel like they are the cause of their own illnesses. This is happening to me. I'm a victim, as opposed to, you know what, maybe I do have a bad temper, and maybe I do internalize things, and I do get frustrated over the littlest things, and I take on too many causes, and I feel like I have to fix everything, and there's so much injustice, and it just really burns me. Those people get H. pylori all the time. I probably described a couple of you. If that sounds like you, put a positive comment, mention it. If you disagree, go for it. I don't know what to tell you. Because there's going to be someone who'll be like, I had H. pylori and I don't care about injustice, which is probably, then you deserve H. pylori if you don't care about all the injustice. I'm kidding. Let's see, what else is there? I mean, I have a bunch of chiropractors that work with me. The chiropractors used to get a lot of grief, especially from medical doctors. And like that stuff, that's dangerous. It's not beneficial. It's like, if you ever had your back cracked and your back's been bothering you, that feels delicious. It's a wonderful feeling. I highly recommend it. Let's see, what else? There's one that I like talking about, and it has to do with weight loss. And many of my patients that come in for weight loss, I make them eat more. Isn't that a ironic little twist? They're not happy about it. And they're usually unhappy about it because they think that eating more is what got them overweight in the first place. And I'm happy to tell you that unless you are binging and consuming 3,000 calories a day regularly, and you're not active at all outside of that niche, I'm suggesting the average person who is a little bit overweight, 20 pounds, 40 pounds, 50 pounds overweight, it's inactivity coupled with skipping meals or insufficient protein or too much carbs. It's not because you're having too many calories. You might be having too many carbs as calories. You might not be having enough calories overall, coupled with inactivity, coupled with blood sugar issues that come from inappropriate fasting and some hormonal and stress-related things. So I get these people to eat more. So they take a second and be like, you want me to eat more to lose weight? Like, yes, we're coming full circle, because these people have been to diet programs where they are forced to eat 1,000 calories a day and allowing the starvation to take over so that they consume their muscle and burn some fat. And then once this period of time, this challenge is over, then what? They can't maintain that. They eat more and they rebound and gain weight. They should be upset with those doctors. I'm giving you a lifestyle. I'm giving you a change that is sustainable, because you should be eating in relation to your metabolic rate. And if you're eating in relation to your metabolic rate, you have to fuel that machine. So that's not too controversial nowadays, because more and more people are talking about, like, you got to eat. You have to eat sufficient amounts and the right things. What else? This is a good one. Should I trust a naturopath? They say that NDs aren't as rigorously trained as medical doctors. That's not true. Who usually study for about a decade before practicing on their own. Some specialists practice for almost a decade, or study for almost a decade. Naturopaths have to have a university degree plus the 4 years. So that's 8 years, if that's how they're counting it. And that many naturopathic treatments are ineffective and potentially dangerous. Well, I also think that's a blatant lie. Well, coming from the perspective of a naturopath supposed to work within their scope of practice, which is outlined by our college and the government of Canada and the province that you practice in. So there's no practices that naturopaths are doing legitimately that are like either ineffective or dangerous, because that is scrutinized and regulated by our college. So that's not true. There are people who call themselves naturopaths that are not doing what they're supposed to, and stay away from them. You should read reviews and get good references or referrals so that you go to someone that's reputable and discusses consent and risks if there is something that's got a risk. I mean, acupuncture, for example, there is some risk of like bruising or some blood, or even worst case scenario, you can puncture someone's lung. If you're not, it could happen. I've never seen it happen, but I've heard it could happen. So, and like anything, like if you get a haircut, there's risks. Actually, I had a barber snip my ear. It didn't bleed, but she went, oh, my ears stick out a little, but come on, like, lady. So there is a lot of nervousness, like critical, like hypercritical hesitancy, where people are like, I don't know, I don't really trust those guys. You don't have to. You don't have to come to us. But there's so much information out there about nutrition and supplements and diets and natural therapies. You should talk to people who do it for a living. Now, just because a supplement is over the counter, you can grab it yourself, to me, that poses more of a risk. Someone self-prescribing. Because I have that. I've had a lot of patients come in. They're like, yeah, I picked this up. I had heard that it's good for my condition, and I thought it was the right thing to do. It didn't help. I'm like, because one, it's very difficult to treat yourself, because I guess my perspective on treating people, it has to do with the whole person and having some objective measures. When you're analyzing yourself, it's hard to be objective. It's almost impossible. And even if you had objective numbers, you get a blood test, you're looking at your own numbers, you're like, yeah, it doesn't look too bad. Especially if you're doing some therapies on your own and you're kind of self-convincing that it's working or it's helping or it's the correct thing. That's why talk to us. We're not scary. I mean, that's actually a good way to get these prompts and see. It's like, what else people saying about? Do naturopaths actually help? There are randomized controlled trials that suggest that naturopathic treatments such as botanicals, nutritional therapies, acupuncture, physiotherapy, I don't know if that falls under naturopath, but are effective at treating some conditions, such as fibromyalgia, migraine, headaches, depression, asthma, hypertension, type 2 diabetes. And that was, what's the reference here? That's from University of Minnesota. Well, I think that's also an interesting take, meaning a lot of people, that's an interesting take, because a lot of people base their comfort on an effect. If there is some kind of study, peer review, a clinical trial that lends itself to convincing someone that a given therapy or style treatment is effective. This can go both ways, in my opinion, because although a positive outcome is like, it can help convince someone that these therapies are effective, it's also somewhat misleading in that this is assuming you're treating in a very allopathic, one-dimensional method, meaning, so when a study is shown to treat something clinically, it's treating a symptom. It's very one-dimensional. This treatment, this herbal formula, for example, helped with this symptom. It doesn't say anything about the individual. It doesn't say anything about other symptoms they might have. And that's why these studies, I think they're useful, but they don't show the whole picture, because if someone comes in with fibromyalgia and another person comes in with fibromyalgia, I'm not giving them the same protocol, which sort of flies in the face of these peer-reviewed studies. Excuse me. They might have some supplements that are similar, but just because I give magnesium malate to one doesn't mean I think that the other will benefit or needs it. So we do mean that we treat the individual. We do customize therapy, because even though two people have a similar diagnosis, doesn't mean that the origin or the cause or the effect that they're experiencing is identical. The symptoms could be very different. The onset can be different. Their triggers can be different. So although there's, useful studies, I tend not to exclusively treat in that way. So as much as that can be useful for someone that's curious or scientifically minded, in reality, That's not how you treat, at least not as a naturopath, at least not me. Okay, well, I'm going to edit all these hot takes and I'll see how people respond. See you later.